information. This is a blended meeting. Welcome everyone. So we have a lot of participants online. Many of our committee chairs will be also presenting online from their homes as we are still in kind of a COVID era. So people are still hesitant about traveling, but we'll have gradually some people trickle in live too, especially who have been attending meeting, and we've been meeting over the last few days. With that, let me start with some basic information. My name is Danish Bhatti. I'm a movement disorders neurologist at University of Nebraska Medical Center, and I'm the chair for APPNA Merit 2021. And I'm happy to welcome you all along with my co-chair and host of this Merit Symposium, Dr. Shahid Rafiq. Shahid, if you want to join me upstairs on the stage, that'll be great. So let me quickly just walk you through what the idea is today. The reason we have been gathered here is to kind of highlight various projects that we have been doing. Merit has been expanding and growing rapidly. We have formed multiple subcommittees, now up to 14 subcommittees within APPNA Merit, each leading various multiple projects and tasks in their own specialist areas. So I thought it was good to kind of go through a quick summary and invite every committee chair who can make it to present what they have been doing, what they have been designing and building, so that we can familiarize all of you. So this is kind of a recruiting event for us. We are hoping to recruit more faculty, APPNA faculty, to join us for our various committee projects. And we're also hoping to recruit collaboration from institutions in Pakistan for various activities and projects that we have been doing. So the way the day would look like is that we will quickly go through some basic introduction of what we have been doing and what Merit is, what Merit stands for, what's our vision, and then we will invite our co-chairs and chair for a quick presentation in 2 to 3 minutes of what they have been doing, what they've been building, and what they're hoping to build and grow. And then we will conclude with a keynote speak from our honorable guest who have especially traveled from Pakistan to join APPNA event. Dr. Faisal Sultan, Special Assistant to Prime Minister on National Health Services Regulation Coordination. And I will then conclude just to talk about how we can collaborate and how can we work together in the future. Our hope is to build faculty, build resources, build online resources, material resources that can help you deliver more within Pakistan, either from within Pakistan or from outside of Pakistan, anywhere in the world, by creating that infrastructure that you would need for transfer of knowledge and technology. So before I talk about what the next 5 years of Merit might look like, let me first invite my co-chair, mentor, advisor, Dr. Shahid Rafiq, to talk about where have we been, where we started, and how we have come to here in a very short, precise 2 minutes. And we will not be introducing any of the speakers, but we will be linking their bio data, either LinkedIn profile on the chat box or their home profile from the university. If you see a LinkedIn profile, please connect with us on LinkedIn. We would be happy to connect with you and follow your work and share our work on LinkedIn. So you will see all the information on speakers shared in the chat box, and no introductions during the talk to keep it precise and on time. So with that, let me give it over to Dr. Shahid Rafiq. Shahid bhai. Let me make sure the screen is shared.
Thank you, Danish. Assalamu alaikum. Good morning, Dr. Faisal Sultan. Thank you for joining us, and all the other worthy colleagues, Dr. Masood Gondal online, always a big supporter of Merit. Basically, I did not prepare a big slides and presentation because I wanted to listen to actual worker and foot soldiers on the ground, the people who are working in various committees and doing the actual work. And also listen to Dr. Faisal Sultan as to what is the situation, current status of healthcare in Pakistan, as well as how we can, have his advice to fashion and to design our programs for the maximum benefit for Pakistan healthcare and medical education. So basically, APPNA Merit started in 2007 as a task force and got approved in a fall meeting in New Jersey in 2008 and formally started as a standing committee of APPNA in 2009 with the founding chair, Dr. Nahid Usmani, who ran it for 4 years and did a tremendous work. She also had this design to, because medical field is so vast, to divide the merit in different committees. And I was the committee chair for neurology at that point, and Baba Rao was heading dermatology. So those committees did a great work. Then a lot of concept work was also done by Dr. Nahid in terms of curriculum building and other specialties. Also working with College of Physician and Surgeon in Pakistan, developing new specialty, particularly emergency medicine, ICU, and other were started around that time. And then later on, pediatric psychiatry was started in around 2015, 2016. But all these efforts, so around that time also we started to delve into the virtual meetings and distant learning. And I remember we did first ever live virtual meeting from San Francisco summer conference in 2009. And we had 3 presenter neurologists from Brown University from multiple sclerosis and pediatric neurology, and there was a 3rd lecture on stroke. And that led to a year-long, every week, live lecture, webinar lecture at that time, which culminated in question and answer, live question and answer session. So that went on, and then, of course, our Dr. Baba Rao led the committee from 2012 to 2016 and took it further, especially active on that time was dermatology, psychiatry, neurology, and pediatric psychiatry. And then when I took over in 2017, we had Danish, in particular, my support and right hand, that we started developing courses. So our process shifted towards online courses because they are the courses which are there and people can join them and learn from them at any time. In addition, we started thinking about capacity building on ground, and we worked with Dr. Nushairwan Barki in Lady Reading Hospital for ICU project. We ran that project ICU for about 2 years, and until that ICU ran on its own consultants after training nurses and on-ground people. Then we worked with NUMS, National University of Medical Sciences, which was just started in 2017, 2016, and various other projects. But then last year, we thought that we should pick a topic for a year, a theme for a year, so that we really go into the depth of that topic and really come up with tangible action items so that we can work on those in the following years. So last year we took family practice, and this year our topic is research and healthcare innovation in Pakistan. So with that, I will leave for the committee chairs to present their work. Thank you.
Thank you, Shahid Bhai. All right, so we're going to try to stay on time, although we're a little behind, but not too bad. And I might give the speaker a little bit of a notice if their time is up to encourage them to wrap up. Let me just quickly talk about what we're thinking in Merit right now. Let me share my screen. So, APPNA merit mission, as we see it, is to improve access to quality healthcare in Pakistan, utilizing Pakistani diaspora through medical education, research, information, and technology transfer. There are aspects that are not covered here, which are covered by other committees. So there's Social Welfare Development Committee, there is medical clinics and mobile health committees, and so on and so forth. So various other committees doing other aspects of that part, but this is what we have focused on as a mandate for APPNA merit. And this is a big challenge. Most of you are already aware of this data. So this is the data I use for people who don't know the background or healthcare challenges. So I'm going to skip that in interest of time. But when I see these dismal numbers, when I started going back in Pakistan, the question was that why can't we train more neurologists from Pakistan? And why can't we here in APPNA cannot train more neurologists from Pakistan? And the most of the requests that I used to get was that, okay, take this guy with you to University of Nebraska, train him and send him back. And I used to tell them, even if I take one a year, it will take me 10 years to train 10. And how good, would that be for movement disorders in Pakistan, or stroke in Pakistan, or things like that? How will that fill the gaps that we're trying to fill? The traditional method of teaching that we have been participating in the past is that we'll go there, we'll give lectures, we'll do skill workshop. I did a lot of workshops. I used to do 3 or 4 workshops every year on various parts of neurology. We did stroke workshops, stroke lectures, but that was not making a sustainable impact. We didn't have any curriculum around it. It was more of just standing there and giving one presentation at a time. So what we started looking at was this idea that online education has really taken hold. People are becoming comfortable, and you can actually teach them through various online tools and methods. And even the smartest guy in the world right now, presumably Elon Musk, is teaching his kids through YouTube and Reddit, online resources, and not textbooks or paper information. So, if we really dissect what learning is and try to divide it into various components, most of them are achievable through online interactions by giving them more than just watching a lecture. So yes, watching a lecture may not be enough to create a lasting change, a culture change, or a habit change, but many things more can be done online instead of just watching a lecture. And that's what when we package it together, we call a course. So, and then we remind ourselves every day that do not let what you cannot do interfere with what you can do. So we want to focus on what we can do instead of always just talking about what we cannot do. So these are the 3 thoughts that we came up with as our objectives last year when we were starting to plan for 5 years. We wanted to develop outcome-focused online programs using modern methodologies to fill in the knowledge gaps and skills gap in Pakistan in certain niche areas. So for example, point-of-care ultrasound. It's something new. A physician is trained to examine a patient and maybe even trained to use a regular ultrasound, but what about this new point-of-care ultrasound, which is handheld device? Similarly, botulinum toxin injections, the Botox injections that I do, various such skills have evolved in the last 10 years that does not exist in Pakistan in a comprehensive way, widespread. We wanted to enhance the awareness and collaboration between Pakistani diaspora and stakeholders in Pakistan. That's another problem we saw, that there was a lot of enthusiasm and interest in Pakistani diaspora, but they did not know where to go and who to talk to and how to connect. And then we wanted to empower the Pakistani diaspora to design programs and deliver a change by providing them that infrastructure. So they wanted to do something, but they didn't have time to sit down and develop everything from the scratch. So how we're doing it, we have been using a 10 steps methodology. We have been establishing subcommittees, which are program focused. We have been developing a decentralized organization structure so committees can feel independent and do whatever they want to do and not slow down by a centralized control. And we have established this virtual office for program coordination. We have been training program coordinator and gathering all the resources, online learning management system, and so on and so forth to be able to implement that. Then we have been strengthening established relationships with institutions in Pakistan, establishing relationships with other alumni association and Pakistani diaspora association in other countries. So we have been working with APPNA, with AP, with APSUC, and so on and so forth. And we have been growing this program portfolio to go to larger audiences. That's another thing that we wanted to do, is to think big. Training 5 people, 10 people is not really impactful. We want to train and educate thousands of people and really think in a large global national impact. Introducing novel concepts and innovations to solve those problems that seem very challenging, explore areas of strength in Pakistan to take advantage, reduce the friction and barrier to entry for people, both sides, here, alumni, and from Pakistan, and align programs with all stakeholders to avoid duplication. We have been doing many different things. Quick snapshot before I invite different program committee chairs to tell them what they've been doing. We have a growing YouTube channel that has been getting really busy with a lot of useful information there. We have online courses portfolio. We have our own learning management system, APPNA Academy, which currently has 9 courses hosted and growing. And we have a partnership with University of Nebraska Medical Center's learning management system, Canvas Catalog, and we have another 13 courses published, and another 6 that we're currently working on with certification from University of Nebraska for those courses that is online. And we have our students do assignments, interact, do group learning, create a community of learning from wherever they are and whatever background they have. We involve them in discussions, in online discussions to learn and with each other. And one such example is our program on family medicine specialty rotation that you'll hear more about from family practice committee chair. And the feedbacks have been excellent. And I think people are really making a change in their clinical practice wherever they are practicing. And with that, I'm going to start inviting different sections, co-chairs and committee chairs to give a 2 to 3 minute brief, quick presentation of what they have been doing and what they would like to do in the future. So I'm going to stop here and let me look at the list and go by one. So let me start by inviting the co-chair for merit research section, Dr. Babar Rao, to tell about what he have been thinking and doing in the research side. And let me pull up your presentation.
Well, good morning, everybody here and in Pakistan or wherever you are. So, is this moving here? I got it. So Danish has and Shahid and all of us came with this idea. They appointed me to lead this idea, which is basically what to do about health-related research and technology in Pakistan. I don't want to be really like the expert in that area, especially Faisal is here. Idea is to work with them and get something done. So to do that, we already have started some webinars which happen on Saturday noontime here in America, which is evening in Pakistan. And so far, we have done about 16 webinars, and we're planning to do 16 more. So the speakers are mostly from pharma, from NUST, from DRAF, from APPNA, from all mixed type of speakers. The idea is if you are a new faculty in Pakistan or a medical student in Pakistan, and you want to do research, where do you go? Or how do you get started? So that's what we are trying to basically help with. And these are list of webinars we have done. That will be then followed up in December 22nd and 23rd. We will host a meeting in Pindi at RMU, where basically idea is all these people from all the agencies we talked will be there. And eventually, we are hoping that with the help from local people and APPNA people, we can come up with a white paper or a document which can be like a resource guide. I still don't want to like tell people in Pakistan, some of them are here, कि क्या करना है, but basically we want to see what they have and what we can add to that, and then people can use it. A researcher, as I said, sitting in Pakistan or wherever they want to do, they want to develop a device in Pakistan, or somebody is developing a device in Pakistan health related, or they want to write a paper, or they want to go to a CRO, कि मैंने अपना clinical trial करना, how should they do it? That's what our idea, and hopefully in December, with help from all of you, we'll come up with a document for future doctors, students to basically look at it and get it done. Thank you. I saved you a minute.
Thank you. Let me see. Let me invite our co-chair for merit medical student, Dr. Taimur. Dr. Taimur, are you on line on panelist? Okay, I am not sure if Dr. Taimur is here, so let me move on. Let me now invite our co-chair for medical education, Dr. Mariam Ghaffar. Mariam, if you wanna share your screen if you have a presentation, otherwise just unmute yourself.
Yeah, Assalamu alaikum. So I'm going to share my screen.
Go ahead.
Okay, so here it goes. Can you see it?
Yes.
Okay, Assalamu alaikum everyone. I'm the co-chair for the Educational Program Committee, and we are developing an online course for faculty development. This course is for APPNA as well as for Pakistani academicians. So I'll just introduce my team. Dr. Danish Bhatti is the chair for this committee, whereas I'm acting as the co-chair. Our course director, Dr. Nurikin Haris, is directing this course, and our course faculty, Dr. Sobia, Dr. Imjad, Dr. Asim, highly qualified, all of them highly talented. And then we have our advisors, Dr. Amir Berni, past president APPNA, and then Dr. Mohsen Zaman, who has already developed some courses for APPNA Merit and APPNA Academy. Our educational coordinator, that's Walid Zafar, who's going to help us in putting all these resources into our learning management system. We are using APPNA Academy for that. So why we are doing that? So American Council of Graduate Medical Education in early 2000 defined some of the core competencies in medical education. It needs to be system-based practice. It needs to be practice-based learning improvement. So what does that mean for us as an educators? That we want our learning to be really transformational. Like our students should be able to see that I covered this, I see things differently, I do things differently, and I am a different person now. Based on that, we created a shared vision that we want to create a short course on an online course development for faculty in APPNA and Pakistani academicians. We need to move away from the past model of teaching to hands-on and relevant to care. And that is like the time for change is now. We require a valid solution to design for training the faculty in online education for an institution resilience and academic continuity. So based on that, we just gave these objectives or outcomes. That is that at the end of this course, our participants will be able to develop an online education course for healthcare providers and students. And then they should be able to create student engagement through formative assignments, discussions, peer learning, and some reflections. And they should be able to apply these evidence-based principles, what is like the student-centered learning is for young and adult learners in a practical fashion. So we have a monthly meeting with our chair, and then we have our directors, advisors sitting with our designing team. We have a weekly meeting, started converging to ideas. So we proposed this plan, which is the flipped model of teaching here, and that is that the didactic lectures are learned by the students at their own time and pace, and the synchronous sessions will be just focused on application, simulation, case-based studies, and problem solving. And we will provide access to latest online educational tools to our students, and we want to give them hand-on training. So for that, we'll be using sandboxes. The framework which we are using is the ADDIES framework here. And we have finalized this approach and conveyed it to our implementation team. And our storyboard is almost complete. We are right now on the stage where we are designing the objective assignment PowerPoints, and we are going to put it into a learning management system at the end of this month, which is APPNA Academy. Now, the scope of this project is that we are starting initially as a pilot in Merit, but we projected to expand it to Pakistani academic institutes, which can be further replicated according to their needs and demands. We still need to analyze the technical support, time, skills, human resources, which will be required over there. And we are already giving our disclaimer that we are not making our learners expert in medical education curriculum development. It's just that what we are doing is that we want to review some specific issues which need to be considered before you are launching a course, or clinical faculty who wants to teach better, some essential teaching skills, finding the right tools for designing any online course. And these principles are applicable to any learner group, so not just specifically medical educationists, like it could be even nursing educators or any allied health services. They can get the help from this course. Thank you.
Thank you. So I think I'm going to just quickly clarify and stress again that this is a faculty development program. The goal is to take clinicians who are practicing, let's say Pakistani diaspora here, who are excellent clinicians or academicians, but they have not developed online courses before, to give them kind of a boilerplate where they can develop an online course in a minimum effort with minimum threshold and do a good quality project so they can transfer their skills and knowledge to other people within diaspora here or in Pakistan. So it's not a certificate course, it's not a master's program or anything like that. It's a actual boilerplate for faculty, kind of a faculty development program. So with that, let me move on and invite the chair for Merit Research Committee, Professor Mustafa Saad Siddiqui. Mustafa, bhai, please go ahead.
Assalamu alaikum, everyone. Merit Research Committee was started a few months back and has a growing list of 18 members. My two co-chairs are Dr. Sarwat Hussain and Dr. Fareed Sori. So we are among the relatively quite new committee. Main purpose of this committee is to have a forum where we can discuss ideas on how to improve the quality of research in Pakistan with the help of Pakistani physicians in North America. This committee is open for anyone to join. Anyone can bring an idea, discuss its feasibility, look for collaborators, and then make a working group to independently take this idea further. Based on the discussions in 5 meetings so far, 2 working groups have evolved. So as a background, the main ask we have heard from from different stakeholders in Pakistan is to have opportunities to collaborate and learn from overseas Pakistani physicians. So based on this ask, we formed the first working group called Research, Education and Mentoring Working Group. This is led by Dr. Faz Anwar, who has a long track record of mentoring many people, which led to many publications. Other members in this group have extensive experience in mentoring and have led to 200 peer-reviewed publications. But the demand for mentorship is huge, and we need a bigger boat with more potential mentors, and that's where we are going to ask for your help. As a first step, we want to develop a research training module so that a person interested in research has basic knowledge on it. This group has created educational materials and identified existing learning modules for this purpose. We will be sharing these resources soon. However, the bigger challenge is to create a system for connecting the potential mentee or a research collaborator from Pakistan with potential mentors or collaborators in USA and Canada. Many ideas have been discussed. Our discussion has narrowed down to developing a searchable database of North American Pakistani physicians, which can include APPNA as well as non-APPNA physicians who are interested in building research capacity in Pakistan. This way, we can entertain requests for mentorship or research collaboration to connect the Pakistani person with the right person in America through this database. Examples of these research requests can be study and grant review, one-on-one mentorship, working in the mentor's lab if this relationship builds further, article peer review, research shark tank, collaboration in registries and clinical trials. In order to develop such a system, we need 2 things. First of all, we need an enthusiastic response from APPNA as well as non-APPNA physicians once we send out an invitation to include them in such a database. There are about 17,000 physicians of Pakistani origin in North America, including many in academics. Many have achieved tremendous success in research. We hope that many would participate in this initiative. Secondly, we need funding to make this database and to support a person who can attend to the needs of this database so that this system works in a seamless fashion. The second group, which has evolved from this committee, is on artificial intelligence and is led by Dr. Sarwat Hussain. And I'm not going to steal his thunder because I see his name. He would be presenting about his group. And with that, I thank everyone, including Danish and everyone else in this committee. Thank you very much.
Thank you so much, Musa bhai. So let me invite the chair of our HIV committee, Dr. Fiza Gilani. For research side, I'm again wanted to share that we are really trying to develop a portal to connect one-on-one people who have a project in Pakistan with people who can advise from here, which is a lot of work, and I appreciate research committee's effort on that.
Great. Assalamu alaikum and good morning, everyone. So this is HIV committee. We have the mission statement that HIV committee will work with the institutions and different physicians and groups in Pakistan. And our main purpose is to reduce stigma, help people with HIV disease in Pakistan, and create effective and culturally appropriate. Oh, right. And our main tools are education, training, and research to help people of Pakistan living with HIV. And we were very successful to develop our partnerships. We have 6 partners so far, and we'll love every other institution to join. This is CMU from Government of Pakistan. We have Center for AIDS Research, Brown University. APPNA is the local chapter of APPNA, and Pakistan Society of Internal Medicine. And our basic team was, actually we started this committee in January, and we had 9 basic members. Then Dr. Bushra's group from Islamabad, they joined, and we planned this year's projects. And our members are from different states and all over USA. So in past projects, before we started this formal committee, we did a few projects in 2019. And this was in response to HIV outbreak in Larkana, Sindh. And we had, that was the time when we developed the partnerships with Pakistan groups. And that was the time when we planned the collaborative conference in USA actually, but due to COVID, we were not able to do it. So our current project is actually we conducted a series of webinars on HIV education, and we will end this first aim with an official white paper. After this, our aim 2 is to create a basic HIV 101 course, and this we'll be working on this next few months. And next aim is we'll translate this HIV 101 course in basic local languages in Pakistan. And number 4 is dissemination of our HIV 101 course, which our partners, CMU, will be helping with us. And basic idea is we'll develop this course on Merit platform, and then we'll provide this on HIV Zoom, ECHO program, which is led by Dr. Bushra Jamil. So we already actually delivered 6 webinars, and we'll be using these webinars to develop the course. We have monthly webinars coming in next few months, and we invite everyone to join if they have any idea. So after these webinars, we'll create 101 course, and this will be catered for healthcare workers and medical students in Pakistan. Yeah. So let me finish this. So our future projects will talk in next few months, and we want everyone to join our group. And this is, it will take the whole world to control the HIV transmissions. Thanks for joining. Yep.
Thank you. All right, we are looking for more partners. This list of partners is not complete. We want to collaborate with everyone. We're not specific to particular people or bound to someone specifically. Let me see. I have Dr. Shahid Rafiq, Chair of Merit Family Medicine Committee next, who will talk about what we are trying to do in family medicine. Do you have slides? Who's sharing? Assistant.
Assalamu alaikum, everyone. My name is Shahid Rafiq, and I'm a family physician from Canada, more particularly from Calgary, Alberta. Can you share it?
I'm not sure. We're not able to see.
Okay.
Okay.
I think Willie said he will do it. So last year's theme was family medicine, and our success story is last year we had a very successful conference in RMU, And a basic concept was to introduce family medicine in Pakistan and what we can do, how can we partner up with stakeholders in Pakistan. Just to, I'll go through a couple of slides. Basically, family medicine, because I'm in Canada and Canada is big in family medicine, there's a family physician. We want them to be a skilled clinician. They are specialists and considered specialists in Canada and USA. So family medicine is a community-based discipline, and basically what we want to achieve in Pakistan also is, one thing is if we can recognize family medicine as a discipline so that they can get their rightful place in the medicine field. And if we can create structure around it, we can provide them support, infrastructure where they can work collaboratively with other stakeholders. That'll be the best thing. So last year when we went to RMU, we have a conference, and after that there was COVID and we couldn't do much. So we developed a course, which was a multidisciplinary course, which was started October last year. And it's almost nearing to finish by October. So we're entering into multidisciplinary, multi-specialty rotations. We have almost completed. So next year, what we're going to do is, from January next year, we're starting a certification course, which will run for a year. And so hope is that we can spread the knowledge to family physicians, if wherever they're sitting in a small village or in remote areas of Pakistan, even in Baltistan or Gilgit, they can get the same kind of knowledge that we have here. And we are collaborating for this program with our partners in Pakistan, with different family physician associations as well. So that's our hope, to reach as many family physicians as possible. Right now, we're engaging about 5,000 family physicians. We are approaching different universities which would like to collaborate with us. At present, we are in talks with 3 universities in Pakistan. So just to show this slide, where we want to be. So that's I'll take half a minute. So if you look at this slide, basically, we're not nowhere near. This is a patient medical home. So at the bottom, that's a foundation. We need the appropriate infrastructure, connected care, administration, and fund, where we want support from the government. And in Canada, I think we are there on ongoing development with quality improvement and research. So if we need help from the government, if we can be there. Thank you very much, I think.
Thank you, Zaid Bhai. So I want to just highlight the family medicine course that we have been working on. The idea is to use the faculty here that we have, such a large number of faculty, to fill in the gaps of faculty that doesn't exist in many institutions in Pakistan. So we can do the didactics part, we can do the education part, we can do it comprehensively through our learning management system, with assignments, with tracking and all that, and then delegate the hands-on skills part and rotation to our local partners in Pakistan to complete it into a diploma. What we do online education will be a certificate, and we can vet it with the university here. We have University of Nebraska, Creighton University. We have hundreds of universities we can reach out to vet that certificate in family medicine, a year-long didactic program with assignments and quizzes. And so on and so forth, and then partner with local universities to delegate them to do the hands-on part of it, to convert it into a diploma per their interest. With that, let me move on to the pulmonary critical care, artificial intelligence committee. Professor Sarwat, we're running behind. 2 minutes, please, on time. If you want to go ahead. Do we have Professor Sarwat? Okay, let me move on to emergency medicine and BLS ACLS committee, Professor Junaid Razak. If you want to unmute yourself and go ahead.
Sure. Thank you so much, Danish. Let me just share my slide. So
I'm here, Dr. Sarwat Hussain. I'm here. I can take afterwards. Sorry.
Okay, afterwards, please.
Great. So last year, I was just looking at my Zoom history, and July 3rd is when we started to work on Emergency Medicine Committee. And over the last 1 year, I'll just go into that. But before we talk about the activities, I just want to emphasize that emergency diseases contribute to majority of disease burden in Pakistan. So unless you fix that, you really can't fix the healthcare. Like many countries, Pakistanis have fundamental expectation of emergency care. So we really need to, if you want people to have a belief in the system, then we need to fix it. And also the past few years, we have had some great developments in emergency medicine in Pakistan, excellent partners there. So it was very opportune time to work on this. As I mentioned, the group was started on the US side, and then we had several consultative meetings with partners in Pakistan about the need. And these are the major activities that have taken place. We have had several meetings, bi-weekly case-based discussions where residents from various training programs in Pakistan presented cases along with their faculty mentor, and we had 2 or 3 or 4 discussants, combination of Pakistani faculty, Pakistan-based Pakistani faculty, and faculty from US. And that actually went very well because it was a very interactive 1 hour. Our members have also supported family medicine training, as you know, and support the module on emergency medicine as part of the GP family medicine training program. We have a life support training initiative, which is very early on. The focus is how do we work with excellent work being done in Pakistan to develop capacity in CPR and trauma care for the frontline healthcare workers. These are early days, and we would really like APPNA membership as well as partners in Pakistan to come together to make this happen and make sure that we don't lose unnecessary lives in our emergency departments in the field. And finally, something very early on, this I feel very passionate about, is looking at chain of survival, is starting from the scene, because often people get to the hospitals late or go to the wrong hospital, and that is a major public health initiative. We'd like to work more on that. With that, I'd just like to acknowledge my colleagues, friends, and other members in the team. I'm sure I'm missing some names, but I'll be amiss not recognizing the APPNA merit leadership, Danish, Shahid Bhai, for all their work. Thank you so much.
Thank you, Junaid Bhai. Professor Sarwat Hussain, if you want to take 2 minutes for artificial intelligence, please be 2 minutes sharp. Go ahead. Unmute yourself.
Can you hear me?
Yes, go ahead.
Assalamu alaikum, everyone. I'm going to share my screen. And so basically, APPNA Merit Artificial Intelligence Committee is in fact the infant and the newborn in the APPNA teams. And we started with the vision that Pakistan will be global leader in healthcare artificial intelligence in the world by 2030. And so our mission is to promote healthcare related artificial intelligence, education, infrastructure, industry, and to become the global leader in the field. As we know, artificial intelligence is applicable in all fields of life, particularly in banking and business, but also in medicine. And you probably know that President of Pakistan created an initiative in about 3 years ago to artificial intelligence and computing to encourage and start grassroots training to produce a team of data scientists in Pakistan to initiate and to progress artificial intelligence. I don't need to define artificial intelligence, but as you know, it can be the basis of progress in all fields of life these days. And if we get left out in this field, Pakistan can leave out lots of opportunity and economic development on the table. And parts of the artificial intelligence are, in fact, all kinds of education and training and prevention and detection, etc. So I would like to invite anybody who's on this team and the leaders to promote artificial intelligence in Pakistan. We will be training the doctors and the medical students and helping them do research in artificial intelligence. And this is an opportunity. This is a ground floor opportunity to enter into a field which can bring Pakistan not only healthcare to all in Pakistan, but also help with the economy to be the world leader in this field. Thank you very much.
Thank you, Professor Sarwat. So next we have the chair of Pulmonary Critical Care Committee.
Thank you, Danish. Assalamu alaikum all. All right, so I'm currently, chairing pulmonary critical care. I'm interventional pulmonology at University of Oklahoma. So no conflicts. So basically, we have 20 members at current. We added one more yesterday. So 4 basic projects that I wanted to quickly go over. The main one that we started with is the Punjab ICU Project. It's basically quality improvement in 3 major hospitals in Lahore under evidence-based, ongoing along with Dr. Shaukat in Lahore. Mortality, morbidity, patient safety, infection control, and satisfaction. So this is something that we made a document to improve and then ultimately mimic that model in other ICUs in Pakistan. Second, which I'm quite passionate about, is train the trainees, a 2-step process. The first step will be training under mannequins, for which we have funding with Dr. Mohsin's effort, about 100,000 from England. And the second phase will be when we will train on live patients. And as soon as we are planning and hoping from this winter meeting in Pakistan. Of course, the procedures will include critical care, general pulmonary, as well as interventional pulmonary, where I'm focused at, but that includes only a few hospitals which have that equipment. The third project will be the webinar series, which we are already enrolled in, helping our family practice colleagues with their specialty rotation. And then subsequently, we will involve our own, subspecialty rotation, including pulmonary, sleep, critical care, and intervention. And the fourth one that has already been started as well is under leadership of Dr. Noor Mahal Kabani. That is going to be, that was in July, I think one of the dates in July in Pakistan, where there was a first nursing-based conference for ICU nurses teaching, and that will be followed by this year with more focused specialty-based nursing training. Thank you.
All right. Next, let me invite Chair of Merit Psychiatry and Addiction Committee, Dr. Noman Ashraf.
Assalamu alaikum. Good morning, everyone. So this is our committee. We have 7 members right now in our committee. I'm chairing this committee for the 2021 for addiction and psychiatry. We started with some goals, and I go through what we did for that. So we want to create the psychiatry content for our learning management system and also for the family practice specialty rotation. So we collaborated with our partners in Australia and UK, in Pakistan. Dr. Ali Hashmi is here. So he has been there in Pakistan, has been helping us out with putting the courses together. We've had our 4 seminars, they're well received, and then we have 4 more to go. And the other goal was to engage medical students in Pakistan, increasing their interest in psychiatry. So I've reached out to the International Federation of Medical Students Association. We are planning some online webinars with them. Also, I've talked to the key people in different alumni here. So we'll hopefully engage all the medical students, do some webinars here. And then when we go to Pakistan in winter, planning some workshops in the medical schools. We want to improve academic footprint of APPNA through research and engaging medical students from Pakistan so they can be part of the research project. We've submitted our first Psychiatry Journal Watch to APPNA Merit, and Dr. Sadiq Naveed from our committee is the lead person on that. And the hope is that eventually APPNA gets to the point where we either have our e-letter or a hard copy, maybe either every 6 months or a year, so we can publish the work that our doctors are doing here. Students outreach is happening to collaborate on research projects, and Dr. Mohammad Zishan is sort of working on that piece. General practitioner engagement for Pakistan. So we're doing these 8 sessions, and then there's a now request that we should come up with a course, 6 months or a year-long course. So we're working on that for them. When we go to Pakistan during winter meeting, we're planning to have a half-day webinar for GPs and students over there too. This is, I think, is very important issue that we want to work on. Awareness of substance use disorder in Pakistan. So one of our committee members, Dr. Majabin Islam, she wrote this piece in 2020. And she said that Pakistan is reported to be the most heroin addicted country in the world. That's what came up in her research. And what we would like to do is creating awareness of substance use disorder in Pakistan. We'll try to work with the academic centers over there to help integrate the evidence-based addiction treatments with other ongoing medical treatment under one roof, improve the medical school substance use disorder curricula. So working with those schools and see if students are getting the training, other residents are getting the training or not. If not, we come in there and we help them improve their curricula. Try to work with the government of Pakistan on making availability of life-saving medications possible in Pakistan, like say naloxone, which is really non-addictive, but it can save lives. So starting from that, and then maybe if we can get like buprenorphine or some medication that are really helpful. And then working with academic centers in Pakistan to establish addiction medicine fellowship. That's the highest goal. If somebody is interested over there, maybe have a training program for folks over there. Thank you.
All right, and then lastly, let me invite Chair of Merit Cardiology Committee, Dr. Mariam Morton. Dr. Morton, please go ahead.
Thank you so much for allowing me to present on behalf of the cardiology group of APPNA Merit. This group is heavily supported by the Association of Pakistani Cardiologists of North America. Their members have been tirelessly supporting the mission of APPNA Merit, as you all know. We are a group of cardiologists of Pakistani descent in America, and we welcome participation from members of the Pakistani Society to improve cardiovascular care. APCNA members have been actively involved in education and training of healthcare providers, both in Pakistan and USA, since its inception in March 2004. We have conducted multiple workshops, hands-on training, educational lectures, series in many institutions in Pakistan, with the signature program being providing pacemaker for the indigenous in Pakistan, educational series in Pakistan as well, while assessing those in the US to further the career. As far as the APPNA Merit platform is concerned, cardiology was the first one to jump in and start the educational lecture series for the family practitioners in Pakistan. I'm happy to report that it was very well received, and we had a very active group on WhatsApp for the attendees, which is still active, where there is generous exchange of ideas, a platform for discussion and communication among the participants. Our lecture series was by voluntary faculty speakers who were handpicked and based on the qualification and the communication skills with the audience. I'm happy to report that it was very well received by all participants. We introduced the ideas of having the speakers introduced by a Pakistani resident working in Pakistan to give them a feeling of achievement. And we had the family practice physicians in Pakistan as the moderator for the sessions. This allowed active communication between the audience in Pakistan and USA. Chat box and QAs were constantly monitored, and questions and queries were answered all throughout the session. This allowed the audience to remain actively involved and follow the presentation as well. Of course, we had quiz and an assignment to be done related to the topic in a week before the next lecture, and these assignments were closely monitored. This allowed the participants to do additional reading and improve on the subject matter. All the lectures have been recorded and archived in the APPNA Merit Program, Library, YouTube, and on Canvas in the UNC. Important thing to note is that there was a great interest in learning and submission of assignments, both by the learners, and they expected it to be graded, and they expected it to be given a certificate. That tells us that they were really interested in getting things done, and it showed that they were interested in improving themselves. Lectures, panel discussion, and Q&A were meant only for 1 hour, but it went well beyond the 1 hour time period, and it extended for almost like 2 hours to 2.5 hours. The panelists were the subject matter specialists, and they answered the questions, and they did not include only people from Pakistan, but also the specialists from UK, Australia, and USA.
Dr. Morton, your time.
Yes, and these are the speakers that we had used. So at this time, the suggestion that we have is, as far as innovation and research in Pakistan and USA is concerned, we would like to continue with the educational lecture series for the medical students and workshops along with the hands-on for established medical institution. We want to have some kind of population studies for cardiovascular risk factors, valvular heart disease, and other cardiovascular diseases. We want to explore primary and secondary cardiac prevention strategies and consider a platform for basic and advanced life support focus, as it has been pointed by Dr. Junaid Razak. The reason is because APPNA Merit and APPNA are both nonprofit professional educational organizations incorporated in the United States, but meant to help those in Pakistan. It is hoped that we will learn from them as much as we would learn from. Thank you.
Thank you. So this was a quick, brief review of all or some of the committees. Actually, we could not have time to invite everyone to present, and not every committee could present all the projects they're working on. We're really hoping to have more Pakistani diaspora, APPNA alumni, join us as faculty and help us in building these programs. And we really love to have institutions in Pakistan collaborate with us in building these programs. With that, to conclude this morning's session, let me invite our keynote speaker. We have the pleasure of having Dr. Faisal Sultan, Special Assistant to Prime Minister on Federal Health Regulation and Coordination, and give us some advice and suggestions on how we can move forward in really helping with the Pakistani community. Dr. Sultan, please.
Thank you very much. Assalamu alaikum. I think this was great. I am personally familiar with what APPNA Merit has been doing, having seen some of the evolutionary years, and of course, got used to emails from Dr. Rao during his heyday at APPNA Merit. And this is a great overview of what all is being done. I do think that a lot of what you are doing lands in a lot of different places. It lands with individuals, individual students, individual physicians, with specialty groups, general practitioners, in some cases with institutions, like you mentioned, Lady Redding. In other cases with specialty services, specialty organizations like professional societies. And this is fine, and this is great. But I think if we are going to have any asks from the government, let me just put forth a few suggestions or a few likely landing places where your effort, which is tremendous, would really go a long way in remaining harmonized and synchronized to what the needs are and what you have to offer. So to begin with, one grand opportunity at the present time is to look at the Pakistan Medical Commission. The academic board of that commission is headed by none other than your recent member and a Pakistani alumnus, currently the Dean of AKU, Dr. Adil Haider. And there are a number of other very senior and very capable, well-renowned academics on the academic board. So I think to channel a lot of your channels into specific needs as identified by the Pakistan Medical Commission might be a great way of having not only targeted and focused and directed efforts from you, but also where they have the greatest impact, and in fact, where they are curated and you're curating them at your end. You have your own channels and your own framework. But it would be very nice if at the other end, there was someone who said, okay, fine, these are the educational or research or other inputs that we require to upgrade either skills or capabilities or knowledge, and to plug them into what the current gaps are as identified by the Pakistan Medical Commission. It's actually an opportune moment because the PMC is now currently investing into a lot of technology and ability to do things online. You may have seen that their entire registration process, renewals, etc., are going to go online. And so therefore, technologically speaking, they are well placed to be able to receive the effort that you are doing. That does not mean you shouldn't do what you're doing already, which is great because it reaches across so many different domains, all the way from individuals to organizations to niche specialty areas. So this is great. But I think from a government of Pakistan perspective, that would be one. The second one, while not directly physician related, but I have to put it out here, is this grand dearth of nursing in Pakistan. I don't know if most people realize that we probably are the most nurse short country in the world. We need about 1 million. We have about 100,000. The gap is about 900,000. The production rate is 10 to 15,000. And anybody with a little calculator or mental math can tell you that it'll take 100 years to get there. And so some leapfrogging is required. And if we can actually help put together how we can get people, nurses, especially with master's training, who can train bachelor's trained nurses, would be an immense contribution into the Pakistani ecosystem, even more than what we can do from what we are doing with physicians or medical students. So that's the second one. I look for ideas from you, see if we can put together something. This year, we have put away about 9 billion rupees to pay for this. We are willing to recruit nurses out of Philippines, UK, US, wherever, and to bring them in as faculty for a 3-year time frame to actually jumpstart the first group of bachelor trained nurses. Obviously, we do have MSNs, but not in enough numbers. We have a shortage of about 300 or 350. So there is a great demand for nursing right now because the institutions have learned that this is something very important for healthcare delivery. But on the other hand, there's a very, very important and almost a pivotal rate limiting step, and that is the dearth of master's trained nurses. So not directly physicians, but these ecosystems work together. The third one, the third place to land, if you will, amongst beyond 100 other things that you're doing, is going to be the new NIH. The new NIH has a Centers for Disease Control that we are building. We're formally inaugurating it this coming week, perhaps a week or 2 weeks from now. And it should be the successor to the NCOC, et cetera, for COVID that's been put in. Within it is the Health Research Institute. It's the old PMRC, PHRC being rebranded, but rebranded to actually provide money and funding as well as oversight of ethics. It is not supposed to do intramural research. That was the other problem, that there was mission creep and it switched away. So there is this Health Research Institute that also might help to prioritize what they will fund, how they will rank and score applications and grant applications, and then how we connect them to some of the research mentoring that I heard about. I think that would be important. There is, of course, other things which are very specialty specific, like related to infectious diseases and conditions that are common and rampant in the country. And so if additional training, et cetera, is required, they may be the other port of call to talk to make sure that all this effort that you make indeed goes and has the maximum impact. I think everybody on this end breaks their back doing it. And it would be very, very important for us to ensure that all this effort is translated into action and benefit. If there are other specific asks, I'd be very happy to hear them. You know how to get a hold of me. Sometimes it's small things that unlock major impact items. We just this morning we talking about OST and anything else really. Sometimes a small step will yield a lot of results in terms of what we are getting to. I would really strongly urge that we build a relationship between APPNA Merit and the PMC for their ongoing CMEs, for their relicensing requirements. This would institutionalize this path. I really think that that would be one thing that would just make sure that all this effort that you're doing actually goes into something. And then there'll be a feedback loop. You will keep hearing back on what else may be required. And you may have even bigger success stories to tell. I think this would be all that I would say at this point. This is a bit nebulous, but I think it actually channels us in a direction where all your effort goes to even more impactful ideas. Thank you. Once again, very grateful to you for inviting me here. It was a great opportunity to come and talk to you. Thank you.
Thank you so much, Dr. Faisal Sultan. This is extremely helpful. We'll follow up on it and learn more from you and get your advice. I think we'll stop here because we have a CME scheduled in this exec hall, and we were told to stop sharply at 8, although we're a few minutes over, and we apologize for that. And we'll stop and hand it over to the CME group. Thank you.